So my name is Rheon. I'm one of the glaucoma specialists working in the Manchester Royal Eye Hospital in the UK. And I suppose that, my area of interest is always about surgical glaucoma, particularly with the innovation front, with new devices, new products, and new surgical techniques that help us to achieve better pressure control and safer approach to treat glaucoma. So I think the unique feature about the eyeWatch drainage system is the fact that this is really the first and only drainage device that we have in the world of glaucoma that has control of flow. So in glaucoma drainage operation, we lower the pressure by creating an outflow. But in creating the outflow, that we want all of us some degree of control of that flow. While most of the surgery that we've had in the past have certain degree of flow, but often it's fixed flow, or we control it with some sutures and so forth. But while the eyeWatch is unique because it's the only device that with technology built in that we can really open and close and titrate the flow. So it literally is like one of my patients asked me, why can't you fit a tap to my eye so it can open and close? And this is exactly what the eyeWatch is offering us, fitting a tap to your eye that we can open and close whenever we need, depending on the pressure need, which is completely unique. I mean, the advantage of the eyeWatch as a surgeon particularly is having that control of flow. So in glaucoma drainage operation, we obviously create an outflow and we lower the pressure. You may get it right most of the time, but sometimes you may find that you create too much outflow and the pressure is too low. And low pressure can be equally bad for the patient in terms of vision and damage. But with the eyeWatch, we now have full control, so that we can open, we can close. So that means that we significantly lower our complication rate, particularly in terms of having too low a pressure. So as a surgeon, literally it's like being able to do an operation, you can sleep very well that night, and understanding that you've got control of that flow. And every patient can be a bit unique, a bit different. So one size doesn't fit all. And the unique features of the eyeWatch allow us to adjust based on the patient's need. And I think that's very special for surgeons. So in terms of the advantage for the patients, again, is surgeons having that control, so that we have lower complication rate and still achieving the target that we need. So with the system that's built in, we have results to show that we are as effective as any tube operation that there is currently so far, because of the design features, the drainage plate or the eye plate. So most of these cases were refractory glaucoma, difficult glaucoma, that now we have a drainage system that we can get the pressure down and save sight or save deterioration of vision. But doing it in a manner or in a journey that is safe and smooth for the patient. So then we lower the complications. So then patient will come out seeing well, having not much complication. So it's not just the destination, it's the journey, and the eyeWatch gives me a smooth journey to get to the low pressure destination that I need. And that's quite a big bonus. So the eyeWatch is special because it's got this adjustable system. We're using a magnet to control and open and close. So the device now, with a good few years in, the surgical procedure has developed well. So overall, the complication during surgery is very low. And then because of the open and close system, we can close it off. So then first day or first week post-op, pressure is not going to be too low. And that's one of the key features with a lot of current drainage operation. There's always a small chance the pressure could be low. And then now we can avoid that. So we kind of can eliminate that side of safety problem. And in the longer term, so far, our data support that it seems very safe and effective. Infection risk is very low, no different from anything else. And people often ask, well, you use a magnet, is the magnet safe? And so far, we know that it's perfectly safe. If you have an MRI scan for your head or for your hips, which involve a magnetic field, it doesn't tend to affect. So is MRI safe with the eyeWatch? We do like to check the eyeWatch afterwards to make sure the opening stays the same. And so far, we've not had any adverse reaction with the MRI scanner. So overall, we have a device itself that seems safe. and we have a surgical procedure itself that seems to be very safe. So I think, we started with the early pre-CE marked clinical trial all the way to CE marked commercial launch, and now have lots of surgeons around the world who's adopted the procedures, and I've had it for over 5 years. I think overall feedback is very positive in terms of, is this level of control that surgeons have that uniquely surgeons like, that you can't get in anything else. So we're having a lot of good user feedback in terms of they like the control, they like the ability to sleep well and not have complications. And increasingly the surgical technique is refined, so then everybody find that the surgery is not difficult to perform, and we're getting the pressure that we need. So you can see that the adoption has been very good, and lots of surgeons from around the world, certainly contact me or many people interested in the procedure, and also getting some good results.